up on your screen. Good morning. Welcome to our monthly Cisne Forum. This platform is yours to share, to network, and to learn. This morning, we have wonderful guest speakers. Joining us virtually, it will be Hillary Fish at 8:45. And from the Honorable Congressman Jimmy Panetta's office, Seamus McKinn. Good morning. I'd like to welcome everybody on behalf of the Cisne Planning Committee. My name is Ina Donato. I'm from Natividad Medical Center, and I'm so happy to be here this morning and be part of this wonderful network. I would like to introduce our fellow Planning Committee members that bring forth this meeting to you every month. Let's see, let's start with Jill. Jill, are you on the call?
I am. Hi, my name is Jill Hoffman, and I'm the International Services Lead for the American Red Cross Northern California Coastal Region. And it's a joy being here. So hi. Welcome everybody.
Good morning, everyone. Thank you all for joining us. My name is Efrain Magallanes. I come here representing the MCOE, the Migrant Education Office. It's great to see you all. Thank you.
And do we have Melissa on the call? It looks like Melissa's not quite on. We have 3 more Planning Committee members. First being Melissa Raya from the Natividad Medical Center Outreach Team. We also have Dr. Hortensia Jimenez from Sociology Professor from Hartnell, and Elizabeth Zepeda from the United Farm Workers. And we all are formed the Planning Committee for Cisne. I would like to take this opportunity to go around virtually so everybody can have a chance to introduce themselves and the agency that we're from, so we can get an idea of who's joining us today. And we can start as we normally do with first name A's, and then we can go down to the Z's. So let's start with first names that start with A.
Hi, good morning. My name is Alma Mandujano. I'm with Natividad Medical Center, and I'm with the Managed Care Department, which would be working with the outreach events in the community.
Everyone, this is Ana
Hi,
Mendoza.
everyone. Good morning. Oh,
Sorry.
Go ahead.
Too many A's. Okay, hello everyone. This is Ana Mendoza from Salinas Adult School.
I'll go next. Hi, everyone. Good morning. My name is Alejandra Garcia. I am with the Monterey County Health Department with the CHDP program. It stands for Child Health and Disability Prevention Program.
Good morning. This is Adriana Albañil from the Migrant Program at San Rita School District.
Welcome.
Hi, good morning. This is Alejandro Magallanes. I'm with the Migrant Education Program.
Hi, good morning. My name is Angela Ruiz, and I'm a CHW with the Salinas Valley Medical Clinics.
Welcome.
Hello, my name is Ana Mejia. I'm with the California Conservation Corps program, and I'm a reporter.
Welcome. Is there anyone else with the first name that starts with the letter A? If none, we can go on to the B's. No B's, we can go on to the C's. None.
Good morning, Constantino Silva, Migrant Education at the Monterey County Office of Education.
Welcome, Constantino.
Good morning, Connie Pineda, Commissioner Officer for District 100 Luis Alejo.
Welcome, Connie.
Good morning, everyone. My name is Ana Vargas from Monterey County Health Department.
Welcome, Ana. How about with the letter D? Anybody with joining us for the first name starts with the letter D?
Good morning. Good morning, everyone. This is Dana Edgel from the Monterey County Behavioral Health Bureau.
Yeah, I don't think anybody's been checking out the diesel. So that's the
D's, E's, F, or G's?
Hi, good morning. My name is Fabiola, and I'm an administrative assistant here in the Migrant Education Program. Good morning all.
Good morning. My name is Esteban Ayala Alvarez, and I'm from Migrant Office of Education here at MCA.
Good morning, Emmanuel Santillan from the YWC of Monterey County.
Welcome. Anyone with their first name starts with letters G, H, I, or J?
Good morning, everyone. My name is Herminia Cervantes. I previously represented Cisne through the Monterey County Rape Crisis Center. I recently started working here at MCOE as a community school coordinator, and I'm really excited to work with all of you.
As are we. Welcome.
Good morning, Hillary Fish, Director of Marketing and Community Relations at Natividad. I'll be speaking today about the Community Health Needs Assessment.
Welcome, Hillary.
I'm the Chronic Disease Prevention Coordinator, and yeah, have a good morning.
Good morning, Jessica. I think your audio was a little off. We didn't quite hear you. Can you repeat, please?
Yes, I'm sorry. I'm driving over to my office, but my name is Jessica Mora Ramirez. I am with Monterey County Behavioral Health. I am the new Chronic Prevention Health Coordinator. So with that, I'll go ahead and mute myself.
Welcome. Thank you. Any other attendees that their first name starts with the letter J or K or L?
Hi, I'm Laura. I'm with Bright Beginnings Early Childhood Development Initiative.
Good morning, everybody. My name is Cassandra. I'm a community health advocate and medical assistant with Clínica de Salud's Outreach Department.
Welcome. Any others that we might have missed that start from the letter A or all the way up to L?
Hello. Good morning, everyone. My name is Alejandra Valadez Garcia. I work with MCOE, Migrant Education.
Welcome.
Thank you.
Hi, my name is Rosa Gonzalez Rivas. I'm from the LSL Union School District Migrant Program.
Okay, any first names that start with the letter M through P?
Good morning, everyone. I'm Michelle with the Housing Authority of the County of Monterey. I am the Family Self-Sufficiency Specialist.
Welcome.
Hi, this is Nancy Majewski from Natividad Managed Care and Financial Counseling.
Welcome.
Good morning. My name is
Ozzy, we didn't quite hear you. Can you repeat, please?
good morning. My name is Ozzy. I'm a community health worker from SVMC.
Welcome. Thank you.
Good morning. My name is Melissa Raya, and I work with Natividad Medical Center over at the Managed Care Department with Financial Counseling and Managed Care. Thank you.
And she also forms part of our planning committee.
Good morning, everyone. My name is Myra Ortiz. I work with Aspire Health, the population health team here at Ryan Ranch under Montage Health.
Wonderful. Thank you for joining us.
My name is
Hi, good morning, everyone. Sorry, my name is Miriam Juarez. I'm a community health advocate with Clínica de Salud.
Good morning. My name is Nubia Padilla, and I'm the principal for alternative education at Monterey County Office of Education.
Welcome, Ms. Padilla.
Good morning. My name is Blanca Valverde. I'm with the Santa Maria Union School District.
And we'll capture the rest of the alphabet, P's through Z's.
Oh, yeah.
Hi, everyone. I don't know if I'm, so I don't know if I'm part of the roll call, but my name is Seamus McKeown. I am a legislative assistant for Congressman Panetta, and very grateful to be here. Thank you very much for the invitation.
Thank you for being here. Okay, so that concludes. Any other representatives that would like to introduce themselves or the agencies that they're from that we might have missed or joined late?
Good morning. I'm Wendy Garibay with Central Coast Energy Services.
Welcome, Wendy. So welcome everybody to our monthly Cisne Forum. At this time, I would like to hand the screen over to our first guest speaker, Hillary Fish, Director of Marketing and Community Relations of Natividad Hospital. She will be going over the community health needs assessments updates. This is a collective survey that was gathered in collaboration with all of the Monterey County hospitals for the first time. So we are very excited to learn what the outcome was of this community health assessments. Hillary, the floor is yours. Thank you.
Thanks so much, Enid. Thanks for having me today, and good morning, everybody. Let me go ahead and just share my screen here. Okay. And here we are. Everybody see okay? Okay. So as I mentioned, my name is Hillary from Natividad. I had the honor of working with all of these different entities to fulfill the 2022 Monterey County Community Health Needs Assessment. So it's Community Hospital of Monterey Peninsula, Salinas Valley Memorial Healthcare System, Me Memorial Healthcare System, Natividad, the Monterey County Health Department, as well as United Way. So we all work together to evaluate the community health needs. This is kind of a big deal because we've never worked together like this before. All of our different entities have worked on a community health needs assessment kind of in a silo. We haven't worked in combining our resources to make a bigger and better health needs assessment. There's a lot of reasons behind this, and I'll go into that, but that's kind of a big deal. And our partnerships really kind of started with COVID. So if nothing else good came out of COVID, it is the fact that we all are working much better together as health entities to take care of our community, because I think that there's power in that if we all kind of are aware of what each other are doing and combine resources, we can get better messaging out. We can fulfill the health needs of our community better, et cetera. So I'll get to why this is all important to you as well. So stand by. Let's see here. So who we are, the Monterey County Health Needs Collaborative, that's the organization that we all kind of created. It's a group of these organizations. We're all dedicated to improving the health of Monterey County residents. We also had support from the Hospital Council of Northern and Central California, which is a big deal because they do a lot of these. So they can help guide us and make sure that we're dotting all of our I's and crossing all of our T's. Typically, the health needs assessment is done every 3 years for the hospitals and every 5 years for the county. Natividad uses the county's information to use their health needs assessment. So we all have an interest, of course, in collecting health information specific to our community so we can address health needs. We can use the same data, identify trends, major health issues, kind of mention that. And then we can also work individually. So we're taking all this information and we're saying, okay, this is a really good fit for Natividad. This is a really good fit for CHOMP. This is a really good for Salinas Valley, Me Memorial, the health department. We're taking all those programs or all of that information and trying to make it a best fit for us as well. So we started back in September 2021 with an RFP for a consultant for this project because it's a really big project. And then once we decided on who we were going to go with, which was this company called PRC, we sent out surveys, interviews, data collection, and then we took all that information, prioritized it, and then we published the community health needs assessment. I'll put a link in here at some point. You can find it on the Monterey County website. I just published it to Natividad. I'm not sure if the link is up, but the page is up. I'll send you a link in just a few minutes here. We have overall, we did really, really well. These numbers are actually very, very, very good according to our consultant. We were able to complete 3,149 community surveys. I don't know if anyone was a key informant on this project or took an actual community health survey, but they were pretty extensive and really, really required some amount of time from the people that took it. And so it was, really amazing that we had that many people take their time and energy to help inform us. We also conducted 128 key informant interviews. So key informants being people that are really key influencers in our community or key players in our community. They could be doctors, political leaders, different types of forum, different types of all cross sector, all kinds of different leaders. Basically, we asked for their personal opinions about what are the needs most affecting our community. We looked at 120 indicators across 6 domains. So those domains are region, age, gender, health, race, ethnicity, income levels, and sexual orientation. So you can see here that we have the data was stratified across the region by, excuse me, I'm just going to move this silly thing over here. Sorry. Data were based on region and zip codes. So we broke it up into North County, Salinas, Peninsula Big Sur, and South County. Look at how big South County is. It's huge. Maybe not by population, but it's a huge, expansive area. Did you guys know that we're like the size of Delaware? Monterey County is the size of Delaware.
Fun fact.
So what were the key issues? These are, yes? I'm sorry. What were the key issues that we identified? So these key issues were identified in part with our key informants and all of the information that we had. So we ranked them, diabetes being number 1, mental health, access to healthcare services, nutrition, physical activity and weight. And then you can see down the list, heart disease and stroke, which is actually the number 1 killer of people, substance use, housing. I know that's a huge one for everyone on this call. Infant and health and family planning, also a big issue for us. Injury and violence, cancer, potentially disabling conditions. So what I'm kind of hearing from the different organizations that were involved with this is that they're going to probably choose those 4 or 5 different key issues to hyper focus on. With, obviously there's some things that we just can't do as well as our entities, but other entities can do well, like housing. So this survey is so important because it's available publicly. So if any of you work for nonprofit organizations or apply for grants or anything along those lines, this survey is very relevant to you. It's just along the lines of like the census information. This is the health and needs information that you can use to apply for grants and apply for requests for sponsorships and things along those lines, or use on your website. So all of our information is very statistically accurate. We had over 3,000 respondents, so we're pretty confident in that. Although I would have personally liked to have seen, we did conduct the survey in Spanish and English. We had a Spanish-English website. We had Spanish-English flyers. Everything was completely 100% bilingual. We had survey takers that were Spanish and English, but our number of people that actually took the survey in Spanish was significantly lower than those who took it in English. So it's definitely something that is very important for us to continue to push toward having a more representative number of survey takers in those different languages. So you all might know this. This is just CDC information. We have cancer, heart disease. I'm sorry, heart disease being number 2 by a thread of just behind cancer. This information is from 2022. No, I think it's 2021. It says 2022. COVID-19 being here, unintentional injuries, stroke, Alzheimer's, lung disease, and lots of other. This is pretty interesting. So when we asked people how they felt that their overall health was, a significant amount ranked their health as fair or poor. Now, if you compare that to California or the United States, it's a bit higher, which was a little bit surprising to me, especially since Salinas in particular has a very young population. So I was surprised to see this. But I should also note that the US information is based on 2022. Excuse me, 2021. Let me go back. 2021. No, 2020. Sorry. Which was the year that COVID pandemic took root. And so we may be seeing some kind of fallout effect from COVID-19, I think, in health overall and also mental health, as we'll get to in a future slide, because those timelines are so much different. You know, it's kind of comparing apples to oranges in a way, not apples to apples. Prevalence of diabetes. So we've got Monterey County at 10.4%. Now this is of known diabetes, not pre-diabetes, just known diabetes. But it is definitely higher in these lower income communities, as well as Hispanic communities. Mental health indicators. So North Monterey County, well, North Monterey County is a bit older. It skews about 10 years older than Salinas. So not entirely surprising, but still, it is interesting. So we've got fair or poor mental health, diagnosed with a depressive disorder, and having experienced symptoms of chronic depression. So significantly higher overall than the US. But again, perhaps a little bit apples to oranges with those dates. This is again, more mental health information, experienced symptoms of chronic depression. So we're looking very much so at the very low to low income, Hispanic, and LGBTQ plus. Drug-related deaths. So this was, I think, substance use as indicated before. Oh, sorry. I think it was number 5 or 6 on the list.
Number 6.
Yeah, thank you, Anna. Okay. And so we've got the drug-related deaths, age-adjusted mortality rates here. So this was interesting, and a very hot button topic for everyone was access to care. And I think that there's definitely ways that we can all, as healthcare entities, do better on this. So we've looked at getting a doctor's appointment as being a really big barrier here. Finding a doctor, inconvenient office hours, cost, prescriptions, lack of transportation, language, culture. I'm actually surprised this isn't a little bit higher. And then 18.9% of adults have skipped doses or stretched a needed prescription in the past year to save costs. So again, 2022 to 2020 information, but interesting, especially how much significantly more it is than the US as a whole. This is an indicator I've seen across many different presentations, but that $400 emergency expense, a lot of people just don't have that on hand, which, can put everyone under stress about, like, should they get treatment? Should they go to the emergency department? What kind of prescriptions can they afford? I mean, all of these things that could come up for people. And this is regarding healthy food. Very or somewhat difficult to buy affordable fresh produce. It's a big number. We're the salad bowl capital of the world. We have tons of fresh fruits and vegetables here. It's sad that we can't afford to purchase that for our residents. Access, this is surprising to me as kind of, this is the first time I've seen this data, but maybe a lot of you aren't surprised at this at all. But it is significantly lower than the US in general and California in general. So next steps. So I mentioned to you how you guys can use this information. We are actively doing presentations and distributing the reports of the community health needs assessment. You can also find it on our website. It's at www, and I'll put this in the chat. Hold on a second. Wherever my chat is, here we go. It's www.healthymontereycounty.org, and United Way has been so kind as to sponsor our website so that it's hosted by a neutral third party. They don't have skin in the game with any one of our hospitals or health department, but they support all of us. And they also have as you can see here on this screenshot, they also have a Espanol version of the site. We are probably not going to, because the health needs assessment is so extensive, we probably will not translate the entire thing into Spanish. We have not yet, but we do have a summary as well as other information. And I know that others are also presenting this information to different communities, including VITA and different organizations, activist organizations. I also mentioned that Natividad, along with the other hospitals, and Monterey County Health Department are trying to collaborate to identify those strategies that we can use together. And then we're also each developing plans on how we can use this information individually, or in our case with Natividad, along with the health department. So I would be happy to take some questions at this point. There's a lot more information out there, and if I can, after I close out my screen here, I will put in the chat bar the link to the actual health needs assessment. And I also have access to a ton of different charts. If anyone's ever interested in presenting any of this information, whether you're applying for grants or presenting it to your community, or doing a Chamber of Commerce or a Rotary Club presentation or anything like that, we have an array of charts that you can use in order to illustrate your information. Given that I had a limited time, I didn't want to go into too much detail with all of that. But I'm happy to answer any questions to the best of my ability, or take the question and give it to someone else.
Thank you, Hillary. I know that was a lot of work, and thank you for taking the time out of your busy schedule to present this, wonderful information. A lot of the callers today are from nonprofit, community-based organizations and are grant funded. So it's so good to have this data at our fingertips. Is there anybody on the call today? I see some clapping of hands. Yes, Rosa, there was a lot of work, and thank you to all who participated and took the time, to take those surveys. You formed part of those 3,000 responses. So at this time, Hillary has the floor open to anybody who has questions or would like more information or more detail. Hillary, can you provide also your contact information in the chat? So
Absolutely.
if they want to ask me. a very, direct question, maybe you can guide them to the right person or contact.
Yeah, and I think Dana had her hand up first. I'd be happy to take that, Dana.
Sure. Well, it's more, I guess, gratitude and appreciation. And just to let you know, this is very timely for the Behavioral Health Bureau, because we also are engaging in a smaller community health needs assessment around mental health, because we're planning for our next Mental Health Services Act plan. So this will be very timely for us. And I see a lot of opportunities around the different areas, particularly as we think about how do we help our residents? Really, my role is around prevention within behavioral health, and noting that our residents don't have access to fresh fruit and vegetables, and recreation and fitness, some of the basic foundations that really support our health and well-being, is important, as well as we look at the kind of spectrum of kind of mental health supports and treatments that are available. So it's hard data to look at in some ways, as we see that mental health is the second most concerning cause, but that's no surprise. And it's really going to take all of us working together collectively. So again, I see a lot of opportunities, and gratitude is, I'm expressing, Hillary, and I'm following up with you, because we need this data, and it'll be, again, very helpful. And I'm curious, have you been able to present to the Board of Supervisors, because our residents need more investment in their health and in their well-being. And I'd be happy to think more together with you or others, but I'm curious if this has already gotten to the attention of the Board of Supervisors.
And I can't answer that off the top of my head. I know that they are aware of it, but I don't know if we've done a presentation yet. So I'll follow up with Krista Hanny. She's actually been very instrumental in being kind of a wonderful leader on this project. So I've been kind of the sheep I've been following and learning from the best, I hope. This is actually my first time doing a community health needs assessment, because typically the county does it kind of in their, it's completely in their lane, and then those other hospitals do that. And then Natividad usually just, or always just uses the one from the county. So this is the first time that I've been involved. So it's been a really neat learning experience. And also just, I think that, we can always do better too, right? So we can always like take that information, digest it, like say, hey, what are we missing, or what can we focus on even more next time around? So
you did mention that there was low response for the Spanish language, and then so maybe not so much a surprise that we didn't see language and culture being identified as barriers because of who responded. And then yeah, I know many folks here are concerned about individuals who speak Indigenous languages and are from Indigenous communities, and so they're a population that probably wasn't able to participate. So
no, and we did make sure that we reached out to people who are involved with those communities and speak English as well as an Indigenous language. So we did have several key informants that participated.
I don't know what's going on.
So a concerted effort on our end.
Yes, and not a criticism, Hillary. I mean, department working together for the first time, that just that's amazing. So just really want to commend all the efforts.
I don't take it as a criticism at all. I'm actually very critical of that because I'm constantly, ringing that bell like, hey, make sure that we are getting, seeing these folks, seeing the people that are somewhat invisible to most of us. So I think that's especially important. So there wasn't really a way to do the survey too easily for folks that do speak an Indigenous language only. But again, we did have interpreters for our hospital as well as other organizations participate in this program. So
thank you.
Yeah, and I feel like I should be very transparent with this particular group. Oh, I'm sorry. I wanted to say that I feel like I want to be very transparent with this particular group that our numbers for those surveys in Spanish were a little bit lower than I'd like to see, because I know that matters to all of you.
Yeah.
And that when we see good representation, better representation, we'll probably get better numbers as well.
You hit the nail. Exactly. There is a request, Hillary, if you can share your slide deck with us. So if either you can send it to Efrain or I, and we can make sure it goes out to the Cisne listserv.
Sure.
There are some in the chat sending me messages that they would like.
And
a
I
copy of
see
it.
Rosa has been waiting very patiently. Rosa?
Thank you. And you did a great job. I think Dana answered all of my questions.
Oh, okay.
She did really good. That's the first thing that popped up in my mind was, how are we representing them, or, how are we catching all the indigenous and I'm glad that you mentioned it as well, because that just means that, you have them in mind, and you're, that Natividad is not just taking part or using a report that's being used, but is actually taking part of it and in representing our community. So I appreciate it. Thank you so much.
Thanks, Rosa.
And I'm a mental health commissioner, so thank you.
Okay, nice to meet you. Constantino?
Yeah, Hillary, great work. Just want to express some kudos to you and the team. And as a director of migrant education, this informs our work very much in the areas that that you surveyed. So I want to appreciate all the work that went into this report, and I do look forward to seeing some of the other graphs that you mentioned, some of the other data. I would appreciate staying in contact with you and having access to some of that other information that you have. And just to put a plug in here, I think Alejandra is going to be talking about this shortly, but we are going to have a migrant parent conference this year, a county-wide migrant parent conference, and we would love to partner with you and as well as others on the call here. So more information on that to come, but I think this is great information that I would love to get out to our parent community. Thank you.
Hey, Constantino, and I'm not fluent in Spanish, but Elsa Jimenez, who's our health director, has presented on this as well. Sorry, so she may be available, or someone else from the health department may be available to present and give out some great information and answer questions.
Wonderful. Thank you.
I love to see the magic of the networking when we do our forums. This is so great. But thank you, Constantino. And I hope you do get in touch with the contacts to help the migrant. And it'll be so nice to finally have it again after so long of COVID. It feels good that we're now getting back to normal.
Absolutely. So I can put this presentation into the chat box in just a moment. I think this slide might be a bit bigger. I'll take a look at that while we're talking and see if I can do that. But you all are welcome to reach out to me if you'd like to receive the entire slide deck, which has just a bunch of different charts and whatnot.
It might be easier, Hillary, not to put it in the chat because it'll be too big for us to put onto our computers. So if you could send it to Efrain and Enid, and then they can send it out. That'd be wonderful.
Okay, sounds great.
So round of applause for Hillary. Thank you so much for presenting today. And we will be sure to take this information and share it with all as soon as we receive that.
Thank you so much for having me, Enid, and everyone.
Thank you. Round of applause to Hillary.
Thank you, Hillary.
Okay, we're right on schedule. Next on the agenda, we have our next guest speaker from our Honorable Congressman Jimmy Panetta's office. Seamus, the floor is yours. Welcome.
Thank you so much for this opportunity to chat with everyone. It's a pleasure to meet all of you. I'll apologize in advance that unlike Hillary, I did not come prepared with a slide deck. So that was put me to shame. But again, thank you so much. My name is Seamus McKeown. I work for Congressman Jimmy Panetta. Unfortunately, the Congressman is not able to attend the Zoom today, and he does apologize for his absence. As I'm sure you're aware, with the election less than a week away, he has a very full schedule right now. He had previously committed to doing another event, and by the time he was invited to speak, unfortunately, we weren't able to get him here. But he really appreciates the invitation and wanted me to extend his thanks to you all. As far as the schedule goes, you might have seen the new 19th congressional district. It stretches from San Jose down to San Luis Obispo, and so we've been on the road a lot as we were chatting before we started. But I'm very excited to speak with all of you. We really appreciate this opportunity because this is just one of the most important issues for Congressman Panetta and for our whole community, as you all know so well. So a bit about me: I handle the Congressman's immigration policy work, including our legislative efforts here in DC. But in addition, I handle what we call our human capital portfolio, which includes healthcare, transportation, infrastructure, housing, social security, labor, workforce, children, families, civil rights, and judiciary policy. So the nice thing is, don't worry, once we manage to completely fix the immigration system, I'll still have some job security. What this really means, of course, though, is that my work involves all the areas that intersect with immigration, intersect with health. As Hillary mentioned earlier, housing, I heard some discussion of mental health. These are all policies that impact people's daily lives. They intersect in a very personal way. So we recognize that things like access to healthcare, transportation to and from work, safe, stable housing, mental health resources, as there's been some discussion today, resources in multiple languages, not just Spanish and English, but also indigenous languages. They're all very important to making sure that that people have access to resources, and that it's not just one silo, of course. With that, I'd like to go through. There are a few topics that I received in advance that we want to go over today, and I wanted to talk about DACA and the DREAM Act. That we would like to talk about healthcare and farm workforce issues, and then just sort of some of what's happening here in Congress right now. So I'll give an update on those topics, and then we'll have. I think we have some time for questions if there's anything I can answer for everyone. So first of all, with the DREAM Act, as I'm sure you all know, since Representative Panetta has been in Congress, he's worked very hard on immigration reform. He would be the first to tell you that as the grandson of immigrants, was raised here on the Central Coast, he understands and respects the need for immigration reform. He appreciates immigrants and the influence that folks who are from immigrant families have on our economy and our community and on the culture here on the Central Coast. I think that's something that's true for all of our team. We all take that to heart. And as far as the congressman, since his first term, he's worked in particular to protect dreamers. This has been a priority for our office. I think on the Central Coast, there are reported 20,000 dreamers. These are folks who are working, attending school, contributing to the community, things that I don't need to tell you. Congressman Panetta has made it a point to reach out to these groups, talk directly to people, let them know how he supports them and how we're continuing to fight for them. And this is a relationship that's very important to our team. In particular, we worked with a number of coalitions over this Congress and the previous Congress to pass the DREAM Act, which is a statutory fix for dreamers, which is an important approach for us to have an actual statutory fix for these people, and not simply to keep going on the authorities under the INA as we've been debating them. The DREAM Act is important because not only is it a statutory fix, but it provides certainty. It allows our neighbors and our friends to stay here, to continue to contribute to the community, to earn citizenship through school, work on military service if that's the route they choose. And that bill, through the DREAM and Promise Act, has actually passed the House of Representatives already this Congress, passed the House of Representatives last Congress on a bipartisan basis. But as we keep seeing, it gets stuck in the Senate. So I'll get to that in a little bit and sort of what our strategy is to really move forward with this, since there's been so much uncertainty. So as far as DACA policy goes, in the background here, a quick recap is that, of course, DACA policy is based on the same logic that we expanded during the Obama administration, which basically says that the Immigration and Nationality Act, it gives the executive discretion to prioritize removals. And so the logic there with DACA is that you have limited immigration enforcement capacity, and you have this statutory authority to exercise discretion. And so the president can say, rightly, that deporting students, veterans, doctors, members of our community, family members is just not in the national interest, especially, unfortunately, when there are actual security concerns. There are actual threats that deserve our attention, and and so, frankly, this is about saying what our resources and our values are. This was first really challenged back in 2014 with the attempted DAPA program, which Texas, of course, blocked under the Texas 1 lawsuit. And that precedent has been really dangerous because it's been brought back into the courts under the new Texas lawsuit, which, of course, I'm sure you've seen, is being used to try to end DACA altogether. So as a result of this most recent lawsuit, the program is now on freeze and cannot approve new applicants, although it can technically accept new applications. It simply can't approve them, and it can renew existing registrations. So people who are in the program, of course, we really urge folks to continue to use this program if they're enrolled. There are some protections which have been extended while this works through the courts. But ultimately, what the Fifth Circuit decision said is that the program is illegal under the INA. It really challenged that statutory authority that the president uses to provide relief. And so that pushes the fact that Congress just needs to step up. We need to do our job. And there are two main directions that we can go with this. One is to clarify the DHS authority to exercise discretion on immigration. We can clarify that they have this authority, which is the question that's been raised through these court cases. Or we can give the statutory fix, which is what we've been pushing for. And we think that there is political will for that. We do think that there is. I mean, this is one of the areas that has seen bipartisan support. It feels like there's less and less bipartisanship on this issue every day. This is one area where we think there is bipartisan support. And so that's what we're trying to do right now. What we're fighting to do, that's what the congressman is focused on, is getting this statutory fix. Again, the bill has passed the House. It's the concern is in the Senate. There has not been enough support to pass this through the Senate so far. A lot of this has to do with timing, unfortunately, and the political will to pass something before the election. What the congressman is hoping, what we're hearing is that in the lame duck session, the Senate should be open to some reasonable negotiations on the issue. For us as a team, again, we can't let people sit in uncertainty, and so that's this is a priority for us, and it's urgent for us, and we respect the urgency that this has for the individuals who are caught up in this system. I can talk a lot about sort of the legal ins and outs of this, but this doesn't change the reality for people who are living this day to day, which I'm sure I don't need to say to anyone here. The next topic, which I understand we want to discuss today, is farm workforce modernization. Obviously, this is very important for our district. This is one of the congressman's proudest moments and one of his proudest legislative accomplishments in his time here in Congress. He is a co-author of the Farm Workforce Modernization Act. And what he would tell you is that he is not only proud of the substance of the bill, but also how it was formulated, the process that we went through to make this bill the way it is, the reason why it's structured the way it is. So under the leadership of Congresswoman Lofgren, who is going to be representing a lot of, we'll see on Tuesday, but who may be representing a lot of our county next year. For 9 months, the Congresswoman sat down with farmers and farm workers, Democrats, Republicans, worked with every stakeholder in this space to pass a real piece of legislation, which can and will pass. This was not easy, but unfortunately, they were able to get to a bipartisan compromise on a lot of these issues. As you may know, the Farm Workforce Modernization Act, what it does do is it allows people who work in agriculture to stay working in agriculture, earn their citizenship, earn their family citizenship. It streamlines the H-2A visa waiver program, the visa program. It makes a lot of investments in farm for housing and labor protections. This, again, passed in the 116th Congress. It passed in the 117th Congress. It is the most bipartisan bill to pass the House of Representatives in over 3 decades. We're very proud of that. We're proud of what went into making it as such. Again, we are running into some obstacles in the Senate, and that's why we're so focused on this year-end compromise. Farm workforce modernization, though, what it really is doing is recognizing what we all know, which is that farm workers are part of the community. This feels, speaking to a crowd of folks here at home, here on the Central Coast, this feels redundant to say, but these are folks who are part of our community. As we harden the border, more people have chosen to build their family here in California, and that's the reality of immigration in the United States today. People who continue to work in the fields, who continue to work in the agriculture industry, need a reasonable path to citizenship. This is a win-win-win. That is the attitude that we brought to this bill. Of course, the challenge that we're seeing again is that there is not a lot of will in the Senate to move forward on an immigration bill going into the election. And so I think it's a big frustration for us in California as well, because frankly, we know that our senators are on the right side of this issue. So it leaves us feeling like there's not a lot of recourse. We are hearing from the Senate, what we've heard on this issue throughout the year is that as we went through sort of the primary season and got here to the general election, that there was not a lot of will on the Republican side to commit to this bill in the Senate, despite the fact that we did get through the House with such a bipartisan coalition. And so what we're doing is, again, we're working to make this into the lame duck immigration compromise, which I will get to at the end here. I want to make sure we talk about what our prospects are for the next couple of months. I think that whether it's from a perspective of labor, whether it's from a perspective of economics, from the agriculture industry, there is a lot of will for this bill. There's a lot of support in this bill, and it comes from a really diverse coalition, which is promising. Our priority is to make sure that it stays front of mind as we work through a compromise for the end of the year, because I think there is an appetite to get something done. And the final topic that I understand we want to talk about today is healthcare. This touches everything. So I'm sure that what I present won't be exhaustive, but I'm open to questions and any suggestions. Healthcare is, it's so important to our immigration approach. And I think that, you all have been doing this work on the ground, so you recognize that what we saw from the pandemic, what we saw about the impact of health access for our communities throughout the last 3 years. It also shows how important it is that we do a better job in investing in immigrant communities and investing in our health infrastructure at home. During the COVID-19 pandemic, the congressman fought to secure $700 million in aid for vaccines, for PPE. It went to farm workers. That was all through the fiscal year 21 appropriations package. We're very proud of that. And then, of course, we came back to this Congress and through the American Rescue Plan almost 2 years ago now, the congressman was able to ensure that mixed status families received economic impact payments and received the child tax credit. That was very important to us in terms of the realities of just our community and our families. But the credit really goes to our local agencies on this. And I'll say this several times, we just owe you a debt of gratitude because of the work that you did in the community with these funds, with the relationships that you've built. The state, the local, and the federal government, they built a true partnership when it came to deployment of vaccines for farm workers. This was just an incredible public health success story. A lot of you were directly involved in this, so thank you again. The federal government provided the vaccine. The state and county governments provided the resources. We had agriculture producers who were able to provide the will and the way for transportation, bringing folks to, the Arroyo Salinas Valley Fairgrounds, working through Clínica de Salud, working with Hartnell, working with the College of Nursing there to make sure that we had folks who could provide the shots. We got folks vaccinated. We had an incredible success rate with that. And that really shows, of course, what we are capable of doing when we work through all layers of government. This program, I'm really proud to say, I know that the congressman is very proud to say this. It was so successful that, of course, the HHS Secretary Becerra was able to come and see for himself how much success we had. So this was something where we were really setting an example, where you were really setting an example for the country. Something else that we saw during the pandemic, which has been alluded to, which we discussed a little bit on this call, is the sort of county programs that we're working with people with different language skills. With we had programs out of the county that were working with folks who spoke Mixtec or Triqui, folks who maybe didn't have Spanish language skills, making sure that we had those connections on the ground. That's something that we've learned a lot from, and that we were really excited to learn about. We want to see how we can support kind of as we leave the public health emergency. That's really the goal now, is to try to turn this into permanent policy changes. So one thing that's come up for the congressman in his committee work on the Ways and Means Committee a lot this year is sort of discussing how do we turn these pandemic lessons learned into legislation. So many of the things that were a success in the county, those were a result of federal funds that were specific to the pandemic. And so our question is, how do we keep the momentum to turn these into permanent programs? And so I think that one thing that's going to be very important for us, which I would ask from all of you, is please stay in touch with us as we go into next year's appropriation cycle. We would love to start having these conversations over the winter. We'd love to identify where we can be useful, because those asks are going to start coming in March and April for where we devote our funding resources for fiscal year 24. So I would just love to chat with anyone here who has thoughts on this, or has a program they'd like to flag, or has an idea for how we can be more effective in the new Congress, because I think the goal for us is to take all of these successes that are happening on the ground with federal funds from there were maybe emergency funds during the pandemic, and turn them into permanent programs. This is something which is also coming up in mental health and telehealth and a lot of the healthcare space. So, we're just so grateful for your work and very open to any suggestions. I cannot overstate how much we take our cues from you in this space, and how much our work is determined by what we hear from the district. So I'll note that on the sign-in, I put my email and my cell phone number. Please feel free to reach out with anything where we can be a good partner there. Lastly, a couple of updates. Not lastly, but one other thing, and a couple of updates. One is that we're very pleased to say that as of this week, the congressman has called on Secretary Becerra to use the administration's authority to expand the Affordable Care Act resources to DACA recipients. This is one of the last places where we have some administrative authority, where we have some executive authority, despite the Texas case and its challenge to DACA and the statutory authority under INA. HHS, we believe, still can expand these health resources, and to clarify that Dreamers have a right to these services, have a right to health care. This is a priority for us. We're very proud to be joining our colleagues to push for that. That's something that I'm pleased to report from the congressman's work in the last week. Finally, I wanted to note that something that's come up that we hear when we come to the community, which I'm sure I don't need to tell all of you, is just how important it is to communicate with our constituents that regardless of immigration status, resources, federal resources, including community health centers, reproductive health facilities, they're here for everybody. And I just want to say thank you for the people who are doing this. I know this is, I'm not saying anything that you have not, that is new, but we hear from people who, we've had calls with constituents, we've had calls with groups where people are unsure whether or not they can seek reproductive health care without being threatened with deportation, and clarifying that these services are available to people, clarifying that health records will not be used to deport you. This is something which is just so important for everyone's public health, and so I want to say thank you for communicating that, and please continue to do so. Please let us know if you need more resources from us to make sure that people are aware of the resources that are available to them. And so I promised we would get to year-end legislation, which I think is what everyone really wants to hear about. There has been a lot of discussions, been a lot of speculation that if Democrats lose the majority, that Republicans aren't going to, that they're not going to want to do anything, that they're going to hold out until next year until it's a pass a unilateral Republican bill. We're hopeful that this will not be the case for several reasons. The first is that it is frankly hard enough to pass a bill through your own party, as I'm sure you have seen from our time in Congress in the last couple of years. It is hard enough to get all Democrats to agree to pass the bill. It's hard to get enough Republicans to pass the bill. And so we even saw this 5 years ago when Republicans couldn't come together on a DACA replacement, this is difficult. And it's difficult to pass something unilaterally. And the second thing is that whatever happens in Congress, the White House is Democratic. The president is a Democrat. Passing a partisan bill does not go anywhere. So there's messaging value, but frankly, there's no reason to pass a bill. It's not going to go anywhere. And so we don't think that there's an appetite to hold out this Congress because frankly, if a partisan bill passes next year, then Republicans don't get what they want either. And most importantly, what I have heard, what we're continuing to hear from across the aisle, is that no matter who's in charge next year, Republicans don't really want to start from scratch on a new bill. There is some common ground. Once you get past the election and folks are able to really focus on the policy of this, and unfortunately less on the politics of this, that folks don't want to start. The Republicans they want to clear the slate for 2023. They want to pass something where there is some bipartisan momentum. So we're very hopeful for that. As I'm sure you've seen in the news, there's discussion about some bills that might get some traction after the election, and so we're tracking that closely. We're talking with our colleagues, talking with the committee to see what we can get through, and we're talking to with folks who are active in this space to make sure that our priorities, specifically DACA and farm workforce, are priorities in any compromise that comes through. Now, the big thing that Republicans have demanded in exchange for a DACA fix or any sort of popular reforms, unfortunately, even reforms that have bipartisan support, have been a focus on border security, which can, of course, be defined a lot of ways, and changes to the asylum system. Now, as for border security, Congressman Kennedy has been to the southern border. He's been 5 times just since he's been in Congress. This is something where he takes it very seriously to have an understanding of what is and is not happening at the southern border. Each time he comes away with the same conclusion, which is that we do need more resources for security. We also need resources for caring for people who come to our nation, for people who are looking for the American dream, for people who need assistance, for people who need help. So something that supports this is, for example, even CBP will say to you that where they really need more resources to address security or trafficking concerns, they'll say it's at ports of entry. So we think that, for example, if we know that most trafficking and most of the concerns that you see in the news are happening at established ports of entry, beefing up those resources makes sense. We think that's somewhere that there is room for compromise. We also want to make really clear that these are not conflicting priorities. I want to be very clear about that. Security does not come at the expense of human rights. It doesn't come at the expense of letting people misrepresent the community. And so I want to be very clear that this is something where we're looking for compromise, that we can get bills through in the lame duck that will serve our constituents. We don't want to look at this as an either or. As far as asylum compromises go, I want to be also very clear that the Immigration and Nationality Act protects the right to asylum. This is a human right. It is codified in international law. We as a nation support it. We have to continue to support it. This is a black and white issue for us. There is a lot of discussion around adjudication and how we, oh, thank you, Dana. I just saw the note pop up there. Where we do see a lot of discussion is around the questions of adjudication and due process and how we can improve the asylum process at the border. When we, of course, talk about border concerns and about volumes of crossing through the border, what we're talking about a lot of the time increasingly is asylum cases. And a lot of people who are who cross the border seeking asylum are ultimately denied. But what's important is that we have a process which respects human rights and gives people due process under the law, gives them access to counsel and the other resources that they are guaranteed under our system. We need to make sure that this is a more humane system. We also think there are a lot of places where we can make it more functional, where we can make the system frankly work better for everybody involved, because we see these bottlenecks that just lead to these issues that end up on the news and misrepresent the entire immigration system. So I think that that's somewhere, again, where we're interested in bipartisan conversations about how we can make the system work better, essentially how we can make the system function better, to be more functional in the process of upholding the rights that are already clarified under U.S. and international law. So one bill that has come up a lot on that, which is being discussed right now, it has gotten some traction, is the Bipartisan Border Solutions Act. I think there's a lot of nuance to this bill, which we're going to need to discuss. And it's also somewhere where we're going to need a lot of input from U.S. stakeholders, because this is something which is coming up in the news a lot right now and that we're taking a look at. I think that gets to the question of how do we improve the process while respecting civil and human rights. That's where we are in the conversation right now, is looking at bills like that, looking at sort of these priorities to just make the process function better as an opportunity for some compromise. And of course, in exchange, the priority for us is to make sure that we are able to deliver on what we've promised on immigration, which is DACA fix, which is fixes recognizing workers and just sort of the economic needs of the community. A few other things that are coming up right now in the end of year debate are the EAGLE Act, the Afghan Adjustment Act. These are programs that expand things like country caps and the green card backlog, deal with allies who are evacuated from Afghanistan last year. These are all priorities that are on the table right now. What is important and what I really want to convey is that no matter what happens in Congress this year, we are going to continue fighting for immigration reform. We've recognized that this is something which goes to the root of our community and to a lot of families here on the Central Coast. These are certainly not an exhaustive list of immigration goals, but I'm absolutely available if there are any questions or any priorities you'd like to share with us. If there's anything that I can convey to the congressman, again, my email and my cell phone are both in the check-in there. If anyone has questions for me, feel free to put them in the chat. I would love to answer any questions, and I'm available for any follow-up. But thank you so much for the opportunity to talk today.
Thank you so much. Let's give them a round of applause for all those updates. Thank you. And we'll be sure to share your contact information there in the chat. Are there any questions for the office of Congressman Panetta today? Specifically, I do see one in the chat, and I see Dana has her hand up.
Well, I didn't have my hand up because I didn't want to dominate, but just bringing attention to the HR 959, which is the Black maternal mental health and Momnibus Act, and just curious about bipartisan support, or if you're aware of it. I do see that Panetta is a sponsor, but yeah, I don't want to dominate, so I wanted to just put a plug there for that.
No, not at all. Let me find. I think I'm unmuted now. I'm trying to pull this up here in my other screen. This is kind of the blessing and the curse of having these Zoom meetings, of course. That I can pull everything up right in front of me, but then I lose the window. You know, this is something which I think we've seen a lot of support. I think that we got a big push from the vice president in the summer. I think that this is something that I mean, just to speculate, I could see us having a conversation with leadership about including some of these priorities in a year-end package. I don't know if this is going to pass as a standalone bill. I think that it's important that we be ready to advocate for these priorities. I think there might be a letter from some of our colleagues that addresses this bill right now. So what I can do is I can flag this for the congressman and say that we would like to communicate with leadership that these are priorities for our constituents, and then whether it comes in the form of a comprehensive passage, a standalone passage, or if we manage to at least take some of the sections from this bill and work them into year-end legislation, I think making sure that leadership knows that's a priority is a really good place to start. So why don't I flag that for him, and then we can download it about any other steps, or if there's anything that you think would be a good angle for us to highlight when we go to leadership or when we go to the committee, and try and make a push for some of these priorities. This is a health bill which actually does not go through our committees of jurisdiction, so we have a little bit less say there, unfortunately, but certainly something where we can use our voice to make sure that we're pushing these priorities.
Thank you. I'm happy to be of help or of support or any way. So I'll send you my email as well. Thank you.
Thank you.
Thank you. I see Jill Hoffman has her hand up. Jill?
Yeah, you brought up so many bills that are so important to our community. In terms of us as a group, in terms of the individual agencies, what are you most hopeful about in terms of the legislation that's going through, and where do you need the help from the individual agencies?
Thank you. I mean, I think there are a few questions there. I think one is about where we need help in terms of passing the legislation. I think that one thing which is always very helpful when we work with stakeholders is saying, you know, to the extent that you have national reach, to the extent that you have national partners, making sure that everyone is communicating with their members of Congress that this is a priority. What I can tell you from where I sit is that we're at the point of the year where we're really deciding what's going to happen in the next 2 months and what we're going to try again in the next Congress. And trying again in the next Congress very often means that we start the process over again, and we have this same sort of push in 2 full calendar years where we're trying to get it into a year-end package before the 119th Congress. And for a lot of these issues, we just can't wait 2 years. We've waited long enough. And so I think that making sure that in sort of the flurry of year-end priorities that members know what need to be their sort of their make or break, what need to be their highest priorities, what they really need to be advocating, to the extent that you have partners across the country, partners in other districts, really pushing those issues is helpful. And then you also mentioned kind of what you can do on the ground. Hopefully I'm answering your question accurately. Please let me know if I'm not. The other thing is in terms of on the ground work, something that I had mentioned that matters a lot to us is what we can learn from the local relationships you're making, what we can learn about how you're implementing these policies. I know that I had mentioned a bit about sort of what we learned from the pandemic. As far as folks in the community go, if you let us know how you're using the funds to really make an impact for our constituents, that makes it a lot easier, and that really helps us to go and know what to focus on when we get to a position, say, on the committee next year, or when we're communicating to leadership what we really need for our constituents. That makes it a lot easier for us to highlight our priorities. It makes it a lot easier for us to do our work if we know how you're using the funds on the ground. So hopefully that answers your question.
Well, partially I was asking, there are wide variety of agencies, 53 people on this call.
Mhm, mhm.
What input do you need from them in order to get this? I know that the health assessment has been useful, but what other kinds of input, like the number of people coming in to request things, services, do you need to know what the bottom line is in terms of the major issues, like what is it, housing, is it health, is it mental health? I mean, what do you need from these particular agencies in order to get those bills passed?
I think as far as year-end legislation, I think you're doing it. I think you've let us know what the big marquee bills are that we need to pass, which we discussed a lot on this call. I think as far as, just so I understand, are you talking about the year-end bills in 2022, or are you talking about our appropriation cycle starting next year and sort of the
year-end bills, the year-end bills.
Year-end bills. I think that honestly, I think that you're doing it. I think by letting us know what the big legislation is that we should be focused on, I think that keeps it front and center for us. You know, I think that we have a lot of competing priorities. So hearing from you, you know, in the context of today's call, saying, you know, we need to make sure that mental health is part of this. We need to make sure that housing is part of this. We need to make sure that the DACA and is the priority for immigration compromise. I think those are all very helpful to us. I think that any member of Congress, when they hear constituent stories, when they hear from stakeholders about the very human impact for the people they represent, it's going to become more of a priority for them. So I think you're doing that. I think that as far as sort of where the nuance in the individual organizations and your experience go and where that relationship would serve us in the long run, it's hearing about some of the smaller accounts that maybe get funded, you know, at a lower amount every year. And we don't always hear all the success stories about, you know, what you did with $10 million and, you know, what you would do with 100. So I think that that's as far as making us more effective through on the ground information. I think that that's a longer term relationship. Does that answer your question?
Most definitely. Thank you.
Okay.
Thank you, Sam.
Sure. All right, please give me a call if you'd like to talk about this some more. I want to make sure that we're getting to everything.
Okay, are there any more questions?
Just a reminder to put your name and telephone number in the chat for Seamus for the people here.
I'm sorry, was that to me? I'm sorry, you cut out a bit.
Yeah, yes, that was to you.
Okay,
Yeah.
I'll put that in
You
right
said
now.
you would do that, and then I think
I'll put that in here right now.
Okay, any more questions? Well, it looks like someone will give you a call regarding assisted outpatient treatment and other, as soon as you put the chat, I believe there are some attendees that would like to reach out to you on certain topics. So thank you all. Moving on, and round of applause for Seamus. Thank you so much for being here today and all those important updates.
Oh, sorry, it's Seamus.
Seamus.
Thank you very much for your time.
Thank you. Okay, so next on our agenda, I would like to give once again the floor to all of our attendees to program share or share any events or tabling opportunities. I know in the month of November and December, things tend to wind down. But if you would like to share, program share any updates, flyers, now is the time. You can raise your hand and I can call upon you or put it in the chat.
So if it's okay, this is Dana again from Monterey County Behavioral Health, and I'm almost embarrassed to ask you all this or to share this, but as part of the Mental Health Services Act, we do an annual community program planning process. It's required by the regulations. The reason why I'm embarrassed, I'm following Hillary and that just awesome, very in-depth, extensive community health needs assessment. In the aims of reducing duplication, I would love to just be able to refer to that one. However, you still have an opportunity to give us your input and information on a more kind of detailed and granular level around mental health needs in our community. So I will put in the chat the links to the surveys, and then Enid, I'll share with you as well information that can be emailed out to everyone. And then we're also asking if organizations, if you have listservs, if you can share them out. We're looking for community members and provider perspectives. They are in English and Spanish. And I'll make sure that I share back the results when we are done, if the group, if Cisne is interested in that. So this will just be really kind of, I'll say, I don't want to say laser focused in on mental health, but just really focused in on mental health. So thank you.
I'd like to respond to you for just a second. I'm American Red Cross, and so we work with disaster mental health. And we have a number of two things that are happening in our community. One, we have about 4 families a month that are affected and may need mental health services. But when they try to get through to behavioral health, there are a myriad of challenges in terms of that. But the other thing is we definitely need Spanish-speaking therapists. So that if you know people out in the community that would like to do bilingual therapy, do crisis work, we get about 3 or 4 families that are bilingual a month that really need those services. And we train you, and then we call on you if there's a case that comes up, a family that comes up. So
Jill, I'm happy to talk with you offline. I know
that'd be super.
Yeah,
That
I
would
know.
be
I know that
wonderful.
navigating the behavioral health system is very complicated. It's very complex, and our goal is to make it more streamlined. So, Seamus, if there's anything that we can do partnership around that, there's some really great models out there around integrated care, and then what Jill's talking about though is a huge need. Workforce in mental health, particularly bilingual, bicultural folks that can do good quality work. So, if there's anything we can do to both kind of grow our workforce around mental health and make things really more accessible for people, because they really get lost in the web. So yes, Jill, let's touch base.
Sounds great. Thanks, Dana. Bye-bye.
And if I may, one thing I did forget to mention is that I think we're hearing increasingly, and it's overdue, frankly, but we're hearing increasingly about the mental health needs that we find in the bilingual and the immigrant and in the second generation community. These are things which are being brought to us more and more, and which I would really appreciate any input or any stories that you can share with us. I think this is something where we'll probably be having a conversation next Congress about maybe some legislation that will get those resources out to everyone who needs them.
Thanks, Seamus.
I see Alejandra Valadez has her hand up.
Hi, good morning, everyone. Yes, as we had previously mentioned, the migrant education program here at the Monterey County Office of Education, we will be having, like Constantino mentioned earlier, we will be having our region-wide parent conference, and this will be held on Saturday, February 25th, and it will be at Fairview Middle School in Gonzales. And we are opening up the opportunity and inviting you all to showcase your agency, whether you'd like to have a table at the resource fair, or if you'd like to have a presentation done. We will be emailing out to the Cisne Collaborative the invitation and the Google document that you can fill out and just complete and return it if you would like to participate either in having a resource table or presenting during one of our workshops sessions. So yes, if you have any questions, please feel free to reach out to me. You can find me on the attendance list or you could write my number on the chat also. Thank you so much.
And what's that date again, Alejandra? February what?
Saturday, February 25th, 2023.
At what school?
It's in Fairview Middle School in Gonzales.
Wonderful. Thank you.
Thank you.
I see there is something in the chat by Lisa McGrath, the Caregiver University Conference for all the caregivers out there is this Saturday at the Tides Motel in Monterey. Spanish translation is available, and there is a link to flyers in the chat box. It also looks like Dana put in the community member survey for mental health. If you would like to participate, the link is also in the chat. And do we have anybody else? Rosa, I see your hand is up, patiently waiting. Thank you, Rosa.
Yes. Hi, good morning, everyone. The LSL School District will be having a LSL Community Resource Fair, and that will be taking place November 5th here at our LSL Resource Center on Del Monte. I'm trying to see if I can find the address here. It's 1441 Del Monte Avenue here in Salinas. It's going to start at 12 o'clock noon. So if you haven't had the opportunity to participate, I'm sure there's probably still some time. I'll put in the chat the information of the person you can contact. But yeah, we're having a community resource fair on November 5th. November 5th, that's this Friday actually, at 12 o'clock. Okay.
That's the day after tomorrow. Thank you so much. And it looks like Lupita Garnica also shared the community resource fair at Martin Luther King Elementary this Saturday from 12 to 4. So if anybody is interested, please reach out to the LSL School District to have tabling opportunity. I'd also like to take the time to announce that Covered California open enrollment is officially here. So with enhancements to the Affordable Care Act and the American Rescue Plan, premiums are extremely affordable. And if anybody is still uninsured in our community and would like to explore enrolling in Covered California, we do have the outreach team that can assist by appointment. You can contact Melissa Raya or Alma Amandujano by calling 831-783-2386. And open enrollment has started and it will end December 31st. Are there any other announcements? I would also like to encourage everybody to sign in to the virtual sign-in sheet. It looks like we have about just about 50 participants, but only about 35 have signed in. So if you can kindly take the time to put in your data there, we will be sure to add you to our listserv so you can get important information such as the slide decks shared today and any other information you'd like to share going forward. Are there any other updates, any other agency that would like to program share?
One quick correction. Yes, the November 5th is going to be located at Dr. Martin Luther King Academy on 925 North Sanborn. And
okay.
From 12 to 4. Yes. From
So
12
not
to 4.
at the LSL. Okay.
Yeah, it's at the Dr. Martin Luther King Academy. Okay.
Okay. Thank you, Rosa, for that correction. Okay, so now is the time I'd like to give the floor over to all of our participants to give recommendations on the next month's forum. Please mark your calendars for our next forum, which will be scheduled for December 1st. We meet the first Thursday of every month. So that will bring us to the 1st of December from 8:30 to 10. And if you have any recommendations, you can please put them in the chat or announce them by raising your hand. Are there any pressing topics? Or I know we're approaching the winter season and food is always, food drives. I see Jocelyn just put in food drives, clothes drives. Yeah, that what was on my mind. What do you guys think our next topic we should focus on so we can bring guest speakers and community resources that can help share information? You can also email your recommendations to our email address confidentially. Our group does look at that, to montereycisne@gmail.com. Is there anyone who has any recommendations, or is anyone on the call that would like to? Yes.
Any updates on on dental and vision? Because I know that during the pandemic, there was a lot of doctors that retired and you know, just closed their practices. So I'm hoping that maybe we have something new or any updates of new things happening. And then also we can get an update as far as the clinic, the new clinic that is going to be opened over by
Is it on
right by-
Sanborn? The one on
Yes.
Sanborn?
Yeah, the update on the new clinic that's going to be opening there. If maybe we can bring the information to the community. Okay.
That would definitely be in the needs assessment of access to care. That will really help. So we have food drive, clothes drives, dental vision updates, access to healthcare. Any other recommendations? This is your forum and we want to make it relevant to your everyday work that will help you bring the tools you need to serve all our families that we encounter every day. So please feel free to send us any recommended topics, especially if you're working with family and you're seeing, you know, the same topic or the same barriers come up. Please send your recommendations to us.
And if there's anything out there for, you know, like the dinners, the Thanksgiving dinners and stuff, because I know that sometimes we get that information at the last minute, or, you know, we're rushing to, you know, get our families to get on the list for Thanksgiving dinners, and then also for any assistance for the December. If we can get information regarding that ahead of time, that would be great.
Ines,
yes.
I know in the past there was an organization, the JCs, that would take students shopping. So I don't know if that would be helpful to get more information, because I know last year they didn't do it. It was not offered to the school. So maybe if you guys could reach out and they could do a presentation, or how to go about referring our students to be on the shopping spree at the, it's usually like the second week in December.
For the JCs. Yeah, we have a lot of great recommended topics. So as a planning committee, we'll go over and vote, and we'll be sure to bring you, you know, a relevant topic. Thank you all so much for joining. It is now 10 o'clock and I want to be respectful of everybody's time. So thank you for joining us. And this concludes our monthly Cisne Forum, and we hope to see you next month. Thank you and have happy holidays.